Perfect. It is showing us live on Facebook and YouTube. So let me just double check right here. I already see a few of our favorites tuning in. If you guys are hopping on, you know the drill. I'll just give it a couple minutes before we get started. I'm going to share this out and then we can kick off our program for today. And please do me the favor as you are starting to hop on here. Give me that thumbs up if you can hear us and see us fine. And start giving me those comments so I can provide some shout outs to all of you. Perfect. I think we're going to go ahead and get kicked off and started. Good morning, everyone. It is Wednesday, and I like to always start off with the day because I feel like every day feels almost like yesterday. So today is Wednesday, believe it or not, and I am coming back to you for our live broadcast. Thank you for tuning in. For those of you that are repeat viewers, I appreciate you guys engaging with us since we hosted these way back March of 2020, and of course, continuing these on a daily basis. Please make sure that you do your part by sharing this out in your network so that others can see about the amazing partners that we have in the community, resources, and other information that we want to keep you updated of. And if you are a newcomer, then you are in for a treat. We bring a variety of folks onto our broadcasts, from experts to elected officials to business owners and business professionals. And so we want you to be as engaged as our other viewers. Make sure that you hit the like button at the very top of this Facebook page, hit the follow so you can get alerted. And if you're viewing this on YouTube, because at the very same time that we're streaming this on Facebook, we actually have it on our YouTube channel, Westminster Chamber of Commerce. Please be sure that you are subscribed to our YouTube channel and let others know that may not be as social media savvy as it relates to Facebook and Instagram and all those, that we are streaming it on this other network. Now, our chamber is also active on LinkedIn, Westminster Chamber of Commerce, Twitter, and Instagram at Westy Chamber, where you can see other information that we posted out. But before I go any further, most of you are aware I am Juliette Abdel, President and CEO of the Westminster Chamber of Commerce, and I am so pleased and very blessed to continue to bring these programs to you. I see with us Melissa and Emilio and Debbie. Thank you guys. Good morning. Thanks for hopping onto this broadcast with us. Now, our broadcasts are designed to be very engaging, and today is no different. In fact, it will be kind of a back and forth segment where we are able to welcome one of our newer members, not only into our network and the chamber, but to you all, and let you know about who they are, the faces behind the business, and learn more about the products and services that they offer. It's our way, especially during COVID, of connecting you all digitally, but still allowing for that personalization. So before we delve deeper into that, I wanted to pull up our first comment. This comes to us from Emilio, a nice good morning message. The comment section of this video is where we would love to engage with you. So if you have any good morning remarks, any compliments you want to give our way, if our text starts sounding like it's off or totally crazy, we want to know about that. Comment it in. And then, of course, as you're getting to know more about who our new member is and learning more about what they have and offer, if you have any questions just in general for them, please type that into the comment section and we'll be able to get to that at the end of our broadcast. I see Ron Clark on here and Chandra and Melissa. Thank you guys for tuning into our broadcast this morning. So you've already heard me glaze quickly over. I have Lisa Phillips. Lisa is with Hope Pediatric Dentistry, and they were actually one of our newer members over the last year, which is, I always tell people we were very blessed as a chamber because we had a number of industry that still were able to invest and affiliate with our organization, especially during such an odd time. And so we wanted to give back by turning around and letting you know who they are, since they haven't been able to engage as most of our other members have in the past. So with that, I want to go ahead and get us kicked off and started. And Lisa, please tell me a little bit about you and kind of your role and the company.
Yeah, so my name is Lisa Phillips. As Juliet mentioned, I am a board certified pediatric dentist and I own Hope Pediatric Dentistry. But I'm also a wife. My husband Cody and I have been married for 10 years. We have two kids, Jaron and Isla. Jaron is eight, he's 8, he's almost 9. And Isla just turned 6, and they go to school here in our area at Holstrom, K through 8. And actually, today's a very exciting day for us because we are getting a puppy this afternoon. So we are now going to be a family of 5.
That is awesome.
Yeah.
What kind of dog are you getting?
We're getting a Labradoodle. He's a little red and white Labradoodle.
Yeah.
A little tiny one. So we decided to name him Gimli from The Lord of the Rings because he had red hair.
Oh my gosh, how cute is that? So, Lisa, you don't know this yet because you haven't had a chance to see our annual program. It's called the Mutts and Struts event, and we encourage everybody that has a dog or a fur baby to really bring them out. And if they don't, then I twist their arm and tell them to adopt on site. So your little baby by June will hopefully be old enough that you can have them play with some of the other pack that will be at that event. Yay for fur babies. Literally, I have a 3.5-pound one that's just running around right now, eager for me to get them out. So Lisa, thank you for sharing a little bit about not only your profession, but about your family and of course the beautiful kids that you have and now this new addition that's coming in. So it begs me to ask, tell me a little bit about Hope. So are you all newer in our community? If you have been new, when did you open your doors? And if you've been around and maybe reinvented, then give us that context of kind of the business itself and when it was formed.
Yeah, that's a good question. So I have been practicing pediatric dentistry since 2010. I graduated from Children's Hospital, Colorado, and I worked in North Thornton for 8 years. And I decided to open my own practice recently, and we just opened our doors in July. So I've been in the area for a long time, but as far as owning Hope Pediatric Dentistry, it's been just this year. So it's been exciting. And when we named Hope Pediatric Dentistry in 2019, we did not realize how much we would be clinging to Hope. So it has, it's been, we have a big story around why we named it Hope. So.
Oh, yeah. Well, you know me, and I love going in detail. So I'm going to start asking you about why you've named it. But more importantly, kudos to you for opening up, especially during the time that we were all in, because not only is it always a risk to get started as a business owner, but to do it in such an unknown environment when, seasoned business owners have been around and are still trying to weather it all, that takes a lot. And I do think that it does cling to that name of Hope. So I'd love to hear a little bit more about why you selected that name to begin with, since you'd been planning this prior to 2020.
Yeah. So back in 2014, Cody, my husband, he developed a virus, and the virus actually attacked his immune system. And he was admitted into the ICU. I was pregnant at the time, 9 months pregnant at the time, and we actually almost lost him. It was nothing short of a miracle that he survived. So essentially, what is happening now with COVID patients happened to him 6 years ago. And so it has, the whole pandemic, everything has really, really hit home for us. But the whole time that he was struggling and fighting for his life, the one thing that he would say whenever I would come in, because I'd come in at 5 a.m. and leave at midnight every day. He was in the hospital for 21 days. He would say, as soon as he saw me and my smile, he had hope. So when we found out that he was getting better and his organs were coming back to normal size and his fluid was leaving his body, the excess fluid, we didn't have a baby room set up. We didn't have a baby name. We didn't have anything.
Right.
And it was right around Christmas. So we ended up deciding to name our little girl Isla Hope. So her middle name is Hope.
Oh, that's beautiful. That is so beautiful. And thank you so much for going in. I mean, I had no idea it was connected to such a personal story. How petrifying that you were going through that at 9 months. Please type in a heart if you haven't already in here, because as you were just sharing that, I was like, I don't know how you did that, because that is tough. That is, you do have to have a lot of hope, a lot of faith, and to get through that and to get through it together. I think that speaks volumes on you all as a couple, and the relationship and environment that you've created. And I already see Debbie, I know all the feels for this commentary for sure. Absolutely. And Ron is sharing the same note. And then I just thank you so much for opening up and sharing that component. So, Lisa, you opened under this idea and this mindset of, I always have hope for the future, hope for better outcomes and positivity. And you opened your doors in July. And then shortly after, you actually came on board with our organization, which is, to do so during a time as a new business and, not knowing what's going on around you. What provoked you to want to get involved more in the community? Because a lot of times people don't understand the scope of Chamber. And I think I've been doing very well over the last year in educating. Here's what we're doing in all facets. But as it relates to you, and as soon as I hopped on, I felt like I knew you, and I hope you take that to heart, because I was like, I feel like you and I already jive, and it was a sense of community that you were trying to connect with. So if I'm wrong, you can be like, no, you're totally left field on this. And if I'm right, go ahead and stroke my ego by letting me know kind of what you were expecting from that.
Yeah, you're right.
Yeah.
So when it was actually the first thing that I did was join on with the Westminster Chamber of Commerce. Earlier, I had mentioned that I worked in North Thornton. It was actually North Westminster. It's like that border area. Mm-hmm. And when I was able to discover this location, which is like the new downtown Westminster, it's up and coming. I was so excited to be part of community. That is huge for my family and I. We're heavily involved in the city of Westminster. Our church is here, yes. We do life here. So we just really have a heart and a love for the city.
I love that. And I've seen already a lot of people that have already started hopping on to the broadcast with us. In addition to all those guests from earlier on, Parker Brown, good morning to you. Deandra in Refugio, Chandra reiterated that she's thanking you for reminding us of that hope and that positivity and the better tomorrow. And I think you could not have captured that even more than sharing that own personal story that you had, which is so terrifying for you to have been in. But look at where you are now, and look how much you guys have grown in that relationship and have grown in the mindset. And it's amazing to see. Deandra is also feeling the same. Hope is a feeling of trust. And I think you hit the nail on the head with that, right? When, especially with your type of business, nobody wants to go to a dentist, like no offense, like nobody wants to, especially to take their younger ones to it when it's already a struggle, right?
Yeah.
And so to equate that sense of hopefulness to the families, to their kids, it really does create this environment where they feel like they're trusting you as a provider and your team. And I just think that's amazing. We have Counselor Scully that's on here. Thank you so much. Good morning to you, Counselor Scully. Thank you for tuning into our broadcast. And Lisa, you don't know this, but I am located right beside you in the downtown. I actually recently relocated here over a year and a couple of months. So hopefully we'll be able to connect in person on one of my dog walks and be able to get to know one another non-virtually, if that makes sense.
Yeah.
So let's keep on diving in, if that's okay. I've got like plenty of questions that I want to ask you just in general, if that's okay. And we'll see if you can. I know you're going to be able to answer them, but if there's anything in addition that I leave out, you let me know. Okay. So obviously, as a dentist or as a pediatric dentist, you have a variety of services that you're offering to your families. What are some of those common ones that people are aware of, and maybe not so common ones that you guys have decided to take on?
So we see children from ages from birth up to age 18. I actually have a few patients that are past 18 that have been with me for a long time. So it's always fun to see them when they come back from college for Christmas breaks and from breaks. But we start off with preventative care. I just truly believe that the earlier we start teaching preventative care to children and to their parents, the healthier our mouths are and the more we avoid dental disease. Dental disease just has become so rampant. So if we can mitigate that with a lot of home care instructions, oral hygiene instructions, and creating an environment where it's fun and celebratory and joyful, then kids will actually want to brush and floss and do all the things at home to really combat the bacteria that can cause the cavities. So that is a pretty big passion for us, is just really creating that healthy environment. But we also do all of the things to treat the dental decay. So we do general anesthesia cases for children who might have fear or might have a lot of treatment that needs to be done, and doing it in 4 or 5 visits might be a little tough for them. We also, we do the typical standard of care for children with fillings and crowns. We do white crowns, silver crowns, white fillings, sealants for preventative, space maintenance, all the things that we have all the skills and training to do all that.
Yeah, and I would push it a step further in saying that you provide not just those services, but a lot of confidence with that for those kids that are going through it. Because and as someone who grew up, my dad used to tell me push out your teeth at certain points. So I had teeth all over the place. You do not even want to see those pictures. But it does. It's in the back of your head, especially as a kid. You're not necessarily thinking about that all the time, but it every time you smile, right? You're fixing that component that you can. And I think it builds in confidence, it builds in character, and it does so much more than just, maintain their oral health and their wellness that's there. So tell us a little bit, Lisa, what you guys have been doing with COVID. Like, are there certain certain measures that you've had to implement, select guidelines that maybe are in place, or tools that you're using? I'm just kind of looking at it from the lens of, someone who might be taking their child in or seeking any of those services, what would they want to know that you guys are providing?
Yeah, that's a great question. So we've been following the American Dental Association and the American Academy of Pediatric Dentistry really closely, because of my experience with what could happen with an attack from a virus. We have been very, very safe, because whenever a family walks in, I see them as part of our family. So I want to make sure that they are in the safest environment possible. So my office was starting to be built in March, right a week before we went to shutdown. And so I decided to put in some extra money and add an ionization system into our HVAC. It's the same filtration system that the Boston Children's Hospital uses, and it essentially filters bacteria and viruses, any kind of debris. So that is an added protection that we've added. We have air purifiers by all of our chairs, and we operate at a lower capacity. So we're seeing one family at a time, so families can feel comfortable that they're in here just with us. And after they leave, we disinfect, sterilize, wipe down everything. We use an acid fogger to clean all of the rooms. So we spray the fog, and then we close the door and we let it settle for a while. Then we go in and we clean it up. And we have every family wait in their car until they're ready to come in. We have them wash their hands right when they come in. And then as far as my team and I, we are wearing all the PPE recommended. So we change our gowns and in between every patient, so we have new gear on. We come into work with regular clothes, change into scrubs, and we wash our scrubs and leave with our clothes. So we're not taking it home to our families. So we've been taking a lot of added measures, and anything that ADA or AAPD recommend that's new, we jump on it.
Wow. I'm trying to capture all of this, and I'm trying to do the best that I can. For those of you that are just now hopping on this broadcast, please get a chance to look through the comments that we've already been making from Lisa. She has opened up and really shared a lot of her story behind herself personally, her brand, the reason behind why she's getting involved in the community more, not just for the business growth, but really for individual growth and support of other members of this community, essentially. And then she's gone in detail very well over what they do for families, from the amazing filtration system that they've added in, the lower capacities that they're following, fogging, disinfecting, and then, of course, to their employees, following select guidelines with their PPE, the scrubs, and then cleaning and leaving them behind before they leave the building, which I think is probably one of the key items and most important things that you can be doing, so that they're not transferring anything, or at least mitigating if there is something that's out there, that they're not bringing it with them. I mean, kudos to you guys. That's a significant amount. So have you, if there's one thing that you want people to know about your business that I haven't already either pestered you into answering, what is one of those that you would want them to know about your business, or just kind of your mantra or philosophy?
Yeah. Thanks for asking that. Gosh, there's so many good pediatric dentists in our area, like you really can't go wrong. But I opened my practice just really wanting to develop this sense of community and family environment. I wanted kids to start young, and then as I get older, they get older, and I could see them graduate and all the things. And I just wanted them to want to go to the dentist,
right,
at a young age and at an older age, watch them grow, help them have a healthy environment, healthy oral health. And I love what I do. I love helping families. I love connecting. It's been actually fun that I see one family at a time, because I get to kind of get to know people really well, and it's been great. So I would say, we're ethical. We follow all the guidelines. We're safe. We're clean. And we're happy.
And I love that. I love that you shared, you want to be growing with them. And I'll do a quick plug and insert. I always say that I'm half Okie, half Yankee. So I grew up east in New York. Every time that I go back to see family or visit family, I stop into my dentist that's there. Not saying that I don't see other dentists, right? I still cheat on them with other people in between. But I still go and I still see my dentist that's there, that I've seen ever since I was younger, all the way to their front office staff that's still there years later. And it brings on so much nostalgia, so much memories. And that's what you want. Like, you want the overpowering, really positive memories and experience of going to a dentist, not so much that they're drilling the cavities in. And believe me, I probably had like every other tooth was a cavity in my mouth. I would eat more junk food than I did regular food. So the number of times that I saw them was probably too many to count on any two hands. But it creates this different experience for them that lasts past the treatment or past the 18 years of age, et cetera. So folks that want to know a little bit more about your business, I've actually dropped in a link into the broadcast, and I see Jeff Wasden. Thank you, Jeff, for hopping onto this broadcast with us, and a couple other folks. I've dropped into the comment section your link to Hope Pediatric Dentistry for folks that want to know more about the services that you offer, about your company, where you're located. But is there additional, either like a phone number, or are you guys on social media that you would want me to also post that in here as well?
Yeah. Our phone number is 303-429-HOPE. 4673.
Love that.
And we do have an Instagram and Facebook page that we're on pretty regularly. And I think the handle is just Hope Pediatric Dentistry. And I think it's called a handle.
It is. No, that you're totally right. No, that's accurate. Yeah.
I was that person.
Right lingo. Yes.
I was that person that was still saying pound.
I still say that sometimes when people are like, that's not the right thing. And I'm like, it's hashtag, right? Like you get it. I'll start doing that. I finally subscribed to TikTok the other day. That's a whole nother story for
Yeah.
time. But you've got to get behind all these social media paths for sure.
Yeah.
So Facebook and Instagram, please do engage with them, like them, and find out more about what they are offering and doing. And as those of you that are watching this video at a later point in time, if we're no longer live, give us that hashtag replay. It's this sign. You can reference it as hashtag or pound. Let us know that you watched this at a later point in time. But if you have any comments or questions that you didn't get a chance to ask of us, please make sure that you comment it or DM the page if you may be uncomfortable and want us to ask that one-on-one. I know Lisa is willing to explain things a little bit more and try and address any concerns or thoughts that people might have, especially right now. I think it's very concerning to try and trust a provider to be inside of your mouth where there are germs and you're just like, oh my gosh, what are you giving me mentality? But at the same time, it goes back to if you are delaying or prolonging treatment on various things, where is that going to take you? We're already nearly a year into this. If you wait an additional year, what does that put you at? And I can probably tell you, it'll put you at past fillings and cavities and decay and root canals and all that great stuff that most of you do not want to experience firsthand. So, Lisa, I know that you and I will probably end up planning a grand opening or something that's very engaging for our public. And we've done this in a number of ways, whether it's drive-by ribbon cuttings that we have all the way to outdoor types of programs or events. So I encourage you guys to make sure that when you do see those events pop up as it relates to supporting them, that we come out and support them fully. Cody, thank you so much for typing in the Facebook page. I've included the link as well onto this broadcast so you guys can see that and follow them and engage with what they're doing on all social media platforms that they have. So before I wrap this up, I do want to reference that we'll be back on another live broadcast before the end of the week, providing you with chamber updates to come up for the rest. If you've not already tuned into the broadcast with the mayor that we had on Monday, or learn more about testing and vaccines, especially for our employers, the dashboard that's out there, and how you can offer that to your businesses, please make sure that you find that video. And then the last shameless plug that I'll throw in there is, the reason why we always recommend people that are involved in organizations like a chamber is primarily for that reason, because they're invested in the betterment of the overall community. And it's a dual relationship that we have. We want you guys to grow and be able to provide you with everything that you need. But at the same time, we want the community to flourish. And to do that, we rely on strong partners. So I do just want to thank you, Lisa. And I feel like Cody is probably your husband. So I'm going to also thank for being so supportive and tuning into the broadcast with us. I thought she did a phenomenal job. But thank you for finding the time for this. I know it's not like you aren't doing other things, especially when you're following the one families per appointment. It makes it very hard for you to add in people when you're blocking off 30 minutes to even be on a broadcast with us. So it does not go unnoticed. I see Alicia. Thank you guys for Alicia for hopping on to the broadcast later on. I know you're hopping on toward the end. This will be available for replay, and all of our videos are available in the video section of our Facebook page. But I do hope everybody has a terrific afternoon, the rest of your day. And Lisa, thank you so much for giving me a glimpse about you personally and about your business. I cannot wait to step foot into the dentistry that you have.
Thanks.
Thank you.
It's been fun.